Since Medicare is a big part of retirement planning and financial planning, I work very closely with many financial advisors, and I oftentimes get asked by both them as well as their clients, when should people start planning for Medicare? When should we start thinking about Medicare and including it into our financial projections, our future plans, and all those things? So in this video, I'm going to talk about when should you start preparing for Medicare and what can you do all along the way. You've worked hard for Medicare. Let's now get the most out of it. Again, I'm Emily with the Medicare Coach, the leading independent Medicare advocate, helping people all across the country, including my parents, easily make their right Medicare decision. I'm not an insurance agent, so you're going to hear me say very different things in all of these videos. Make sure that you subscribe to my channel and like below in order to get more insider tips to make the most out of your Medicare benefits to protect your retirement savings and have the best healthcare possible. So when should you start planning for retirement? Again, I get this question a lot from financial advisors as well as individuals. And the thing is, it really depends. But most of the time, I recommend that everyone starts planning for Medicare at least at 64 years old. That's about a year before most people will be joining Medicare. Now, here's the thing. Just because you're planning at 64 does not mean that you have to join Medicare at 65, but it's all about understanding what are the costs. What are your options? How to avoid penalties, how to avoid double paying for health insurance, and also just to save you a lot of time as well, okay? So again, at 64, there are a few things that I recommend that you be looking at. Number one is, are you required to join Medicare at 65 or not? Number two, if you have an employer plan or something that meets Medicare rules, are you better off, from a financial standpoint, are you better off joining Medicare or are you better off delaying it? Okay, so really about the cost of your health insurance. Number three is, those more detailed costs when it comes to your healthcare, What will you be paying for Medicare? What will you be paying for your A and your B and your supplements and your Advantage and your D plans, all of those things, which I cover in so much more detail in other videos. But it's so important to get those costs right because people, I think, underestimate and sometimes even overestimate what the cost of Medicare is. I see some people kind of kicking and dragging into Medicare because they think it's going to be bad and expensive health insurance, but that's not usually the case. Medicare can be great health insurance if you know what to do. So by doing that research at 64, you can actually have data to make an informed decision and be confident with what you're doing and what your future holds, okay? I also recommend at 64, you start thinking about different surgeries you're going to be having coming up, whether it's going to be a hip replacement or a back surgery or whatever it might be. There are certain things that you can do and really plan for retirement if you're thoughtful around it as well. So again, most of you will be planning for Medicare at 64 years old. Now, with that said, when it comes to Medicare, there are always exceptions, okay? I was working with a couple last week whose daughter's in her 20s and she has Down syndrome. And the parents want to retire, but they're trying to figure out what to do with the daughter's health insurance. Now, come to find out, for the daughter's unique situation, she can actually qualify for Medicare in her 20s underneath certain disability rules. So my point is this, while most of you are going to be planning for Medicare at around 64, there are exceptions. So if you or loved ones have disabled family members who are under 65, there are ways to get Medicare to cover their health insurance. It does require some pre-planning though. And so again, if you're in that scenario, let us know or comment below. But there's certain steps that you should be doing early on because there's usually a 24-month waiting period or a 24-month process in order to get Medicare before 65, all right? And on the other hand, some of you will be delaying Medicare past 65 because you or your spouse are working past 65 and you have health insurance through an employer that, number one, meets Medicare rules, and number two, is actually better health insurance than Medicare. And in that case, I do recommend that you still kind of start that process out at 64, but really get serious about planning for Medicare about 6 to 12 months before you intend to retire. Again, planning around the costs, planning around the next steps, planning around how to make sure that everything goes in the right order to avoid penalties and avoid lapse in coverage. All right. So again, it's never too early to start preparing for Medicare, but most of you will start planning for Medicare around your 64th birthday, right? 12 months before you join Medicare, or at least you're required to meet Medicare rules. Again, I'm Emily with the Medicare Coach. I'm going to provide some extra resources down below to help you easily navigate Medicare because I know it can be a mess. Again, here's helping you easily make your right decision to protect your healthcare rights and your retirement savings.